Hello and welcome back to Gen Z Nars. So ayun, hello guys. I hope you are all doing fine. Sa lahat-lahat po ng ating mga manonood dyan, stay chill and learn. So before we get on to the topic na what is multiple myeloma. So nag-interview muna ako ng mga ibang tao. Kumbaga ano yung mga alam muna nila about this disease or yung multiple myeloma. Ano yun? Multiple myeloma? Di ba cyst yun sa ovary? Tama ba? Ayan. Daming tao. Ay, ano yun? Multiple myeloma? Di ba ano yun? Sakit yun sa balat eh. Ang alam ko sakit yun sa balat. Ate, bili-bili na kayo dito. Bili na kayo dito, oh. Sariwa tong mga isdang to. Sariwa to. Ay, ano po yun? Multiple myeloma. Alam ko na yun eh. Narinig ko yun eh. Di ba cancer yun? Cancer yun, di ba? Cancer yun sa ano? Mga yun na nakita. Cancer yun sa utak. Cancer yun sa utak. So for this episode, we will learn about what is multiple myeloma. First question would be, what is multiple myeloma?
Multiple myeloma is a type of cancer that affects plasma cells. Plasma cells are a type of white blood cells found in bone marrow, which is the soft tissue inside most of the bones that produces blood cells. In the bone marrow, plasma cells makes antibodies. These are the proteins that help the body fight off diseases and infections. So multiple myeloma occurs when an abnormal plasma cell develops in the bone marrow and reproduces itself very quickly. The rapid reproduction of malignant or cancerous myeloma cells eventually outweighs the production of healthy cells in the bone marrow. As a result, the cancerous cells begin to accumulate in the bone marrow, crowding out the healthy white blood cells and red blood cells. Like healthy blood cells, cancerous cells try to make antibodies. However, they can only produce abnormal antibodies called monoclonal proteins or M proteins.
Second question would be, what are the signs and symptoms of multiple myeloma?
The signs and symptoms of multiple myeloma vary depending on the person. Initially, symptoms may not be noticeable. However, as the disease progresses, most people will experience at least one of four major types of symptoms. So these symptoms are generally referred to by acronym CRAB, which stands for calcium, renal failure, anemia, and bone damage. High levels of calcium in the blood come from affected bones leaking calcium. Too much calcium can cause extreme thirst, nausea, vomiting, upset stomach, loss of appetite. Confusion and constipation are also common symptoms of increased calcium levels. Kidney failure can be caused by high levels of M protein in the body, which is produced by the myeloma cells. For the anemia, it is a condition in which the blood doesn't have enough healthy red blood cells to carry oxygen to the rest of the body. This happens when cancerous cells outnumber red blood cells in the bone marrow. Anemia often causes the fatigue, dizziness, and irritability. So for the bone injuries or bone damage and fractures, it occurs when the cancerous cells invade the bone and bone marrow. These lesions appear as holes on the X-ray images. They often cause bone pain, especially in the back, pelvis, ribs, and skull. So for the additional symptoms of multiple myeloma, it may include the weakness or numbness, especially in the legs, unintentional weight loss, confusion, problems with urination, nausea, vomiting, repeated infections, and vision loss or vision problems.
What are the risk factors of multiple myeloma?
According to the American Cancer Society, here are the few risk factors that could affect someone's chance of getting multiple myeloma. First is the age. The risk of developing multiple myeloma goes up as people get older. Less than 1% of cases are diagnosed in people younger than 35. Most people diagnosed with this cancer are at least 65 years old. Next is gender. Men are slightly more likely to develop multiple myeloma than women. Next is race. Multiple myeloma is more than twice as common in African Americans than in white Americans. The reason is not known. Next is the family history. Multiple myeloma seems to run in some families. Someone who has a sibling or parent with myeloma is more likely to get it than someone who doesn't have this family history. Still, most patients have no affected relatives, so this accounts for only a small number of cases. Next is obesity. Being overweight or obese increases a person's risk of developing myeloma. Last is having other plasma cell diseases. People with monoclonal gammopathy of undetermined significance or solitary plasmacytoma are at higher risk of developing multiple myeloma than someone who doesn't have these diseases.
How is multiple myeloma diagnosed?
Routine physical exams, blood tests, and urine tests can uncover evidence of this cancer. More tests will be needed if the physician finds signs of myeloma when the patient don't have the symptoms. Using the following tests, the physician can monitor the progression of the disease and determine whether the patient needs treatment. First is the blood and urine test. Blood and urine tests are used to check for M proteins. These proteins may be caused by multiple myeloma or other conditions. Cancerous cells also make a protein called beta-2 microglobulin which can be found in the blood. Blood tests can be used to assess the percentage of plasma cells in the bone marrow, kidney function, blood cell counts, calcium levels, and uric acid levels. Next is the imaging test. X-rays, MRI scans, or CT scans can be used to determine whether bones have been damaged by multiple myeloma. Next is the biopsy. During a biopsy, the physician removes a small sample of bone marrow with a long needle. Once a sample is obtained, it can be checked for cancerous cells in the laboratory. Various tests can determine the types of abnormalities in the cells and how quickly the cells are multiplying. These types of tests are used to determine whether the patient have a multiple myeloma or another condition. If multiple myeloma is found, the test can show how far it progressed. This is known as staging the cancer.
How is multiple myeloma treated?
First is the biological therapy. Biological therapy medications use your body's immune system to attack myeloma cells. The pill form of thalidomide, lenalidomide, or pomalidomide is usually used to boost the immune system. Lenalidomide is similar to thalidomide, but it has a fewer side effects. It also appears to be more potent. Next is the targeted therapy. Targeted therapy medications block a chemical in myeloma cells that destroys proteins, causing the cancer cells to die. The drugs that may be used during targeted therapy include bortezomib and carfilzomib. Both are administered intravenously or through a vein in the patient's arm. Next is chemotherapy. Chemotherapy is an aggressive form of drug therapy that helps kill fast-growing cells, including myeloma cells. Chemotherapy drugs are often given in high doses, especially before a stem cell transplant. The medications may be given intravenously or taken in pill form. Next is the stem cell transplant. Stem cells transplant involves replacing diseased bone marrow with healthy bone marrow from a donor. Before the procedure, blood-forming stem cells are collected from the patient's blood. The multiple myeloma is then treated with radiation therapy or high doses of chemotherapy. Once the diseased tissue can be destroyed, the stem cells can be infused into the patient's body, where they move into the bones and start rebuilding bone marrow.
And that's the end of our video. I hope you learned a lot and clarified the misconceptions about multiple myeloma. So see you in our next video here at Gen Z Nurse channel. And this is your future nurse, Noela, wishing you a great day ahead. And please stay safe and see you soon.
Birds and the bees and fill the sky with the songs and the